Have you ever second-guessed how to help clients navigate healthcare planning? Well, you're not alone. It's one of the most common topics advisors ask us about. I'm Julia Fuentes, Financial Planning and Coaching Senior Specialist at Vanguard. Today, I'm uncovering the top 3 healthcare-related questions advisors bring to the table, so you can feel more confident, better equipped to support your clients through one of the biggest financial decisions they'll face. So let's start with a big one. How do I help my clients plan for healthcare costs in retirement? When we're talking to our clients about their retirement healthcare costs, we need to think about this in some separate buckets. Traditional healthcare costs. We go to the doctor, we get our prescription drugs filled at the pharmacy. These top 2 line items, those are going to be covered by your Medicare plan when you turn 65. But then there's other out-of-pocket costs that we face in retirement that original Medicare is not going to cover. And that would include dental, routine vision, and hearing aids. When it comes to dental, some clients will do a dental insurance plan and other ones will pay out of pocket. When it comes to vision, a lot of people will pay for their eyeglasses, their eye exams, contact lenses out of pocket. So when we're helping our clients plan for this traditional healthcare cost bucket, and we're talking about Medicare, people that are age 65, we don't want to frame it as a big scary number, letting our clients know you need $350,000 in this bucket. Because you don't tell them you need $500,000 for your food in retirement, so we don't need to frame healthcare that way. We're going to budget for this, help them break it down to what's my monthly cost, what's my annual cost. Now, long-term care, this stands alone. As our clients age, some of them need help with getting out of a chair, going to the bathroom, the activities of daily living. Medicare isn't going to cover those costs. This is a risk that we need to help our clients understand that Medicaid, that is the program that aids the poor. Medicare cares for the elderly. So to qualify for Medicaid, you have to have low assets and low income. So that's a last resort. That's not a way we're going to plan for this risk. And you know there's a lot of ways to cover the long-term care bucket. And it's very customized to your client's unique situations. Well, the other thing is you might be thinking, well, my clients, they don't retire at 65, they retire early. And this is even a bigger conversation. We need to help our clients understand how are you going to bridge the gap to Medicare, because you can't go on to Medicare until you're 65. So we need them to understand what are their retiree health benefits. How do their retiree health benefits convert to a Medicare plan when they turn age 65? Some people permanently forfeit their benefits by accident. Maybe their spouse will continue to work and they can ride on their spouse's health plan. Some people will look at COBRA options, but keep in mind, COBRA, that means your insurance will continue, the same insurance you had through your employer. But it's a short-term solution for voluntary retirement. You're going to get 18 months of coverage, and it can get pretty expensive because now your client is paying what the premiums they were used to paying, what their employers subsidize for them, which is quite a lot, and an additional 2% administrative fee. So a lot of people will turn to the Affordable Care Act marketplace plans through healthcare.gov. This is where you can lean in as a financial advisor and help your clients with income planning. If we can get their income low enough, they can qualify for premium tax credits to reduce their monthly premiums. These plans get very expensive as you age. So at age 64, the premiums will be expensive if they don't qualify for subsidies. But when we're working with our high income clients, a lot of them will turn to direct private insurance to get their coverage that way. Sometimes they can get a better network, maybe eke out some additional benefits since they're paying top dollar. So it's really important for us as a financial advisors to help our clients understand the costs of retiring early and the costs when they retire and transition to Medicare coverage. The second question that comes up a lot is, when should clients enroll in Medicare and what happens if they miss the window? So you can't enroll in Medicare just whenever you want to, and a lot of our clients think you can. It's in strict enrollment time periods. Your first time you are eligible for Medicare is a 7-month window around your 65th birthday month. This is called your initial enrollment window. And if you are disabled, you might be eligible earlier than 65, but for most of our clients, 65 is going to be the age. And if you are retired, you are going to want to sign up in the 3 months ahead of your 65th birthday month. Because if you enroll in the 3 months ahead of your 65th birthday month, your coverage will start on day 1 of your 65th birthday month. But you also have the 3 months after your 65th birthday to enroll. But your clients will say, I'm still going to work. I'm never going to retire, because if I retire, I'm going to die. I'm never going to quit. And do I have to sign up for Medicare? I love my insurance through my employer. Well, this is where your clients talking to their friends can sometimes get into trouble, because it depends on your health insurance. We want to have our clients check with their benefits administrator to find out, do I have creditable health coverage to allow me to delay signing up for Medicare until later in life when I retire? The risk is for your small business owners, for your clients that work with small employers, less than 20 employees. Oftentimes, their health insurance is not creditable coverage. And what this means is they can face late enrollment penalties and coverage gaps. But many of your clients work for the large employer. Oh, I have more than 20 employees. Well, in that case, chances are they have creditable coverage, which allows them the option to delay signing up for Medicare until later in life. They will get a special enrollment period. This is an 8-month window that you get after you lose coverage to sign up for Medicare without any penalties. People do this all the time. Keep in mind that maybe one person is working and the spouse is riding on that coverage. They are also able to delay as long as it's creditable coverage. Once you retire, you're going to have to prove that you had creditable coverage from age 65 on. Encourage your clients to find out where they're getting the best value, because I have some people that Medicare actually is giving them better coverage for the same or better pricing. So it's worth doing the research, seeing where you're going to get the better value. Now, the third question, and the last one we're going to go over today that we hear a lot from advisors, is how do I factor healthcare costs into my clients' income and tax plans? And this is really important because when your clients transition to Medicare, there is something called the Income-Related Monthly Adjustment Amount, or IRMAA. And the way that this works is every year, the Social Security Administration is pulling your tax return from 2 years prior. So your 2025 Medicare premium is based on your 2023 tax return. So what we want to look at is modified adjusted gross income. We're going to find your adjusted gross income on your 1040, and we're going to add to that your municipal bond interest. So everybody always groans. It's like, oh, munis count here. Even though they're tax efficient, not going to help you with this Medicare income-related tax. So if you are a single filer in 2025 and you're a penny over $106,000, you're a married filer and you're a penny over $212,000, now you're going to start having to pay more on a monthly basis, both for Part B, that's your outpatient procedures, and for Part D, which is your drug plan. You'll notice these numbers are monthly per person costs. So as an advisor planning for this, we want to think about doing Roth conversion strategies well before your clients transition to Medicare. Roth conversions can hike your clients' Medicare premiums. Once our clients turn 70 and a half and they're charitably inclined, we want to help them understand that the way we give to charity matters. If you give to charity through a QCD, a qualified charitable distribution, you might be able to potentially lower your Medicare premiums. Dividends, capital gains, that all counts towards this equation. So we do want to help our clients understand the benefits of tax-efficient investing and also investment vehicles such as health savings accounts. Because when we have a big pile of money there, and we spend for qualified healthcare expenses, it's not going to hit our adjusted gross income, and it can help us with our Medicare premiums. Thanks for watching today. Like, subscribe, and turn on notifications so you never miss an update from our team about healthcare in retirement.